Hello, everybody. Thank you all for joining us. I've got Emily Smith and Kim Jasek here with me, and I'm going to just quickly introduce myself, and then maybe as each person picks up their. Actually, we'll do introductions at the beginning because I think Kim doesn't come on till the end. So I'm Katie Luffel. I'm a nurse in the Family and Child Health Division, and I focus on maternal mortality prevention and perinatal quality improvement. And Emily, do you want to introduce yourself?
Sure. Hi, everyone. My name is Emily Smith. I'm the Director of Evaluation at the Division of Family and Child Health at the Department of Health. And Kim.
Thanks. Hi, everybody. So my name is Kim Dasik. I am a nurse practitioner. I work with VCHIP, which is the Vermont Child Health Improvement Program, and the Perinatal Quality Collaborative Vermont on various perinatal community outreach projects. Thanks. Back to you, Katie.
All right, next slide, please. So we are here today to talk about a strategic plan and some of the activities in this grant, which is the Maternal Health Innovations Grant. It's a federal grant from HRSA, and its purpose is to reduce maternal mortality and severe maternal morbidity, so death or illness, to people who are pregnant or postpartum in Vermont, and advance sustainable improvements in maternal health, service delivery, data collection, policy development. There's 3 goals, which you're going to hear echoed later on in this presentation because we organized our strategic plan around them. And the goals of the grant are to improve access to care that's comprehensive, high quality, appropriate, ongoing throughout the entire period preconception, so before you even get pregnant, all the way through that full year postpartum. And then also to enhance the state maternal health surveillance and data capacity, so understanding what the state of maternal health is in Vermont, and identifying and implementing innovative interventions to improve outcomes for populations disproportionately impacted by maternal mortality and SMM, and then which is severe maternal morbidity. So I am going to pass the next few slides over to my colleague, Emily Smith.
Hi, everyone. So as part of this grant, we are tasked with developing Vermont's first maternal health strategic plan, which we are very excited to do. We hosted several online kickoff events orienting folks across Vermont to the grant itself and what the goals were. And then we hosted an in-person summit in July to gather information from folks who are working directly with perinatal population across a variety of different settings to understand what the successes and gaps in care are across our regions. Through those processes, we came up with this desired outcome in that all birthing people in Vermont feel safe, supported, and empowered during their pregnancy's birth and throughout their postpartum experiences. So we're really holding this as our North Star as we move through the strategic planning process and ensuring that all of our priorities are in service to this mission. Next slide. So as part of this maternal health strategic plan, we need a structure in place to help drive implementation and keep us accountable to the priorities that we have set as a state. And so part of that is developing this core partner task force that will help keep us on track. And the activities of the task force will range and adapt based on the needs of the grant as we move through the grant period. We'll have an opportunity to engage in some topic-specific projects as those arise. And here are some examples of the projects that we might form work groups around. We've heard from folks across the state that topics of interest include perinatal quality, perinatal mental health, perinatal substance use, community-based services, data and evaluation, and policy. So thinking about how we can elevate the work that is happening at the regional level to facilitate statewide systems improvement. Next slide. So here we're going to get into the body of the strategic plan. So these are the recommendations and actions that we've curated through this data collection process. And this is our feedback form. And I can actually put the feedback form right in the chat. If you would like to follow along, the information that we're going to cover in the slides is the same as the information in the feedback form. You can also just sit and digest the information and complete that feedback form later if you feel like you want to give feedback, and the QR code for that is also right here. I just want to elevate as well that all of the recommended actions in the strategic plan are taken directly from the data that folks across Vermont have provided us. So this is really the statewide strategic plan. This is not the Vermont Department of Health strategic plan. We are looking to be responsive to things that folks said they want to see in action moving forward in the maternal health space. So with that, I will hand it over to Katie to, I think, kick us off with our first goal.
I didn't unmute. Can we go to the next slide, please? So the first goal was, again, around improving access to care for folks. And so we broke it down into two strategies. The first one is focusing on supports for the perinatal person moving through different spaces. And the second one is a little more around the workforce piece. So I'm going to have you go to the next slide, please. So the first strategy is to create continuity of care for birthing people, supported by systems integration, care coordination, and low barrier services. So some of the recommendations around that are to look at reducing barriers to access for home visiting programs, including community-based supports like the doula and the nurse home visiting services. So right now, they're not universally available across the state, or they're not universally accessible for folks. So we just want to look at that and try to understand how to make those easier for access for families. And then reducing barriers to prenatal education and support services. We heard for quite a few regions now, and every time we've done these presentations, that is echoed that there's a lack of preparation for birth, and especially a lack of preparation for the postpartum period. So just how do we support that for regions? Looking at methods to support collaborative team-based care across providers. And the thing to emphasize in this one is to think, when we think about providers, we're not just thinking about our obstetricians, right? We're thinking about the people that provide care during pregnancy in the clinical setting, but also in those community settings. So what's happening across both settings to improve that collaboration. And then the last one here is improving the utility of centralized maternal health resource hubs. So we've heard from a lot of partners, like, accessing resources and referring feels difficult or to navigate, and they're not quite sure what's available. So instead of introducing something brand new, possibly we're looking at like, how do we understand how to improve the utility of what we already have, and or supplement it as needed. So next slide. So this one is looking again at that workforce piece. So we've also noted from across the entire state gaps in workforce, whether it's doula care, whether it's nursing, whether it's midwives or obstetricians, really a lot of gaps there. So some of the pieces and the recommendations are around training. So cultural competency training, trauma-informed trainings, professional development opportunities, things like that. And then some of the recommendations are more around other services like interpretation services, and then some recommendations for care, which, we say a lot of times in here, we're not mandating anything, we're just recommending. So like what is a best practice recommended for comprehensive transition recommendations, including patient follow-up. So again, not just in that clinical care, but also what are the recommendations for follow-up in the community for folks. Looking at reimbursement rates for perinatal providers, again, including mental health specialists and community-based service providers. So not forgetting that we need to look at reimbursement rates for everybody who provides those supports. Loan forgiveness programs to attract perinatal providers to the state. Manageable caseload recommendations. We've heard from patients and providers that it sometimes can feel overwhelming, the caseloads that are happening, and that patients sometimes don't get the time they need with the face-to-face with their providers. And then looking at professional development pathways to address workforce shortages, including perinatal specific mental health and substance use professionals. All right, I think I pass it back to Emily again.
Great. So our second goal is to enhance state maternal health surveillance and data capacity. So next slide, please. And as a first step in this, we need to assess the maternal health landscape. We can't know where we need to drive change until we fully understand what data we currently have access to and where the gaps in data are across our state. So we expect to identify indicators and gaps in our maternal health data landscape through an extensive mapping process that will be collaborative across our partners in the regions. And we would like to facilitate more comprehensive data collection and integration across maternal health partners with a focus on elevating the utility of tools that currently exist. So not reinventing the wheel, not putting in another procedure, another ask, really taking a look at how folks are collecting data, how they're utilizing data, and making connections where it makes sense. So elevating platforms like our family care plan and intake and referral data, assessment and monitoring data that programs are already collecting, and outcome and impact data that people are sharing across the state. So how can we collectively understand what is currently being done and used and build on that? Next strategy, thank you. And strategy B is to monitor new and ongoing programmatic initiatives and efforts to improve maternal health. As part of this grant, we are mandated to have an evaluation plan. Usually, this can look like a box that we check for the federal government. We track some process indicators associated with implementation of grant activities and send that into our federal funders so that they understand what we're doing. We want to make it a little bit more than that. We want to ensure that our evaluation plan is utilization focused, that folks across the maternal health space have access to what we're looking at tracking at the state level in terms of grant activities. And how can we utilize this tool that we have to make to help paint the picture of maternal health across the state? So including what programs are doing, what successes they are gaining, what gaps or barriers, challenges they're experiencing to program implementation, and what those outcomes look like across our state. And then we understand that many programs are both ongoing and will be implemented as new initiatives under this grant. And so we know that capacity is low across the entire state. Infrastructure is being reduced. Everyone's kind of facing this resource scarcity environment that we're moving into. So how do we make sure that we are tracking all of the good work that's happening across our state? So we'll be implementing a technical assistance model of evaluation, wherein we will be providing evaluation expertise to regions, to organizations, to partners to ensure that they have the tools and the infrastructure necessary to tell the story about the work they're doing in the way that they want to tell it. So that'll be an initiative under this strategy. And then strategy C is to increase data sharing across agencies and partners. This looks like elevating and disseminating findings from evaluations and studies that are happening across our state. It looks like building connections between partners so that we can share data across its many different forms where it makes sense. And we'll be providing some technical assistance across within this data sharing domain. So if it makes sense and folks want to increase their ability to share data between partners, we want to help facilitate that. If that means providing technical assistance on how to write a memorandum of understanding or a data sharing agreement so that we can build those relationships across the state and our partners. And we want to elevate recommendations for further investment in data infrastructure, modernization, and integration at the state level. So how can we really make this a standard of systems integration such that maybe other sectors can learn from the good work that we're doing here in the maternal health space? And then, Katie, you want to take this one?
Sure. So our last goal is identifying and implementing innovative interventions. So this is a big piece of maternal health innovations grant, and no surprise there. And so we have some projects that we are working on implementing, and I'll talk a little bit about some of the recommendations here too. I'm going to go to the next slide, please. So the strategy, we only have one strategy here, which is to integrate the community-based services and peer networks into the maternal health system of care. So really looking at integrating across spaces and elevating some of those peer supports as much as possible into existing clinical systems of care. And so the recommendations here are supporting and developing sustainability plans for innovative initiatives. So things that are rising up that we're supporting. So how do we make them sustainable? Past the life of the grant, supporting and implementation for regional activities, which I'll talk about in a second. Then also providing some support and technical assistance for grant writing activities for folks, because we know that we have a lot more capacity at the state and understanding how to write those grants. And then we have the regional PQCs, which I'm going to circle back to in a second, and facilitate ongoing communication and convening of partners across the state. So looking to make sure that when we're disseminating learning from the grant and some of the activities that everybody has access to that. And then also hosting an annual summit. So we had one this summer. It was really popular, but we were limited by space on our first one. But there was such a great response that we really want to do it again on a larger space with more partners. We had, I think, about 90 people participate this summer. And so I'm going to circle back to one of the major innovations of this grant and looking around some of the goals of integrating and supporting communication across spaces, the clinical and community spaces. And that is to support the regional perinatal quality collaborative approach. And Kim Dasick is going to talk more about that. The things that I want to point out about this this approach is that we were really looking to identify and support interventions from regions that are sustainable and replicable. So is it working in one region? How can we replicate and expand it into other regions? So those are some of the goals of those regional PQCs. And I'm going to turn it over to Kim to do these next few slides. Sorry, this is another one. This is just talking about that feedback form and providing us with written feedback, and then also knowing, really important to let us know what's missed or how do we make the recommendations better. So go ahead and use that form or unmute when we get to through the slide deck. And then now next slide.
Awesome. Thanks, Katie. So I'm just going to expand a little bit more on the regional PQCs. So the state is investing in these because it recognizes the importance of engaging local leaders from a variety of settings to reduce that maternal mortality and severe maternal morbidity, as Katie talked about at the beginning. So there are currently 6 regional perinatal quality collaboratives planned, combined regions with Newport and St. Johnsbury working together, St. Albans and Morrisville, Burlington and Middlebury, Barry and White River Junction, Rutland and Bennington, and Springfield and Brattleboro. And some of those regions already work closely together pretty routinely, and they make sense because they share resources or services. Others might be newer, different pairings than what folks are used to seeing, but the family child health coordinators at those regional offices have agreed that this structure works for their collective needs for this purpose. So those are the 6 regional perinatal quality collaboratives that will exist in Vermont. I want to go to the next slide, Emily. So with the regional PQCs, the goal is to build on those existing health coalitions and local expertise. So as Katie said, and Emily as well, the intention is not to create anything additional or being cognizant of capacity, but really trying to elevate current efforts and then replicate or expand interventions that have been successful. We know that no one knows or understands the needs of a community better than those who serve it. So the hope is to incorporate voices from all areas of that perinatal spectrum. So folks who might see people pre-pregnancy or in a contemplative state, or who work all the way through those early childhood spaces. And the regional PQC teams will be led by those local family child health coordinators, and the activities or interventions will be planned based on the concepts from the strategic plan that Emily and Katie just shared. We really want those groups to be think tanks and hubs for innovation and connection in their regions. And funding is going to be available to all of those regional PQC teams, and the FCH group will be establishing a simple request form, a request for a proposal process that will be completed in order to receive those funds. And VCHIP and the statewide PQC is available to help sort of set up or scaffold those regional collectives, and then to provide support with quality improvement efforts, including monitoring and evaluation, and then communication within the broader perinatal network. You'll see on this slide there is a timeline here. Right now we are in the middle of doing a lot of informational sessions with different organizations and regions from around the state, and of course in the midst of the strategic plan feedback period. And then the maternal health task force will then get started in the new year. So if you have attended any of the MHI kickoff or any other meetings, you're probably already on our radar. But to be sure you're included in any activities for your region, there is a QR code here, and I can drop the link in the chat where you can sign up to get notifications. That's probably about it on that front. Happy to take any questions if there are any. We'll drop that in the chat now.
And I think we have one more slide, which is just sort of a wrap up. Thank you. It's got an email address there if you want to reach out as well directly, and we'll send this slide deck out. But I think it might be nice if we get rid of the slides and then just offer. So this, we really wanted to offer you guys a chance after familiarity and hearing this to give us feedback. So we would love it if people feel comfortable unmuting and or putting stuff in the chat. Any initial response to the strategies or anything that struck you as particularly actionable or things that we're missing?
Hi, this is Clarice Lazary. I'm from Friends in Adoption. I do a lot of virtual presentations, and I know it's hard when you have the crickets. So I would love to, and maybe at the beginning you talked about this, and I have audio and issues going on, so I'm on the phone and the computer. But anywho, is there a timeline for everything?
I would say, yeah, like Emily, you were right. You saw a little bit of a timeline for the regional PQC piece for the larger grant. So the grant is a 5-year grant. We finished year 1 just this fall. We're in the beginning of year 2. We're always hopeful that there's future cycles of the grant, but right now we're in year 2 of 5. And the task force piece is coming together in the new year. As a convening, and that task force initial, job of the task force is to finalize the strategic plan. So we've got the draft version, we're updating it, and then they'll finalize it. So Emily, do you have stuff to add?
Yeah, the strategic plan is meant to be iterative. We will review it on an annual basis to make sure that the recommendations are still relevant to the needs of Vermonters. So the task force will revisit that and continue to make revisions as needed. Katie said, the task force, I think, is hoping to stand up in early 2026. We will look for additional opportunities to engage folks in those topical interest groups as those needs arise. And then there was one other thing. Oh, the next summit that we plan to have that be annual, tentatively looking in, Katie, correct me if I'm wrong, September 2026 for that.
Yeah, we're hoping to have it be after school starts, but before like a lot of the sort of fall conferences are happening. It's hard to fit it in there with summer and school and all the fall stuff. So
Yeah.
that's what I thought in September.
So when you said engage folks in 2026, are you thinking they'll be like, of course, I'm thinking everyone on here and all the other providers in Vermont, would we be participating? Would you ask us to participate on, committees, or what would the level of engagement be?
That interest form that we mentioned in the last slide, and I'm happy to circulate that link as well, that has a continuum of participation
Okay.
embedded within it. So it has opportunities for you to tell us how you would like to engage in this work, whether you just want to stay informed via our newsletter, or if you want to be part of reviewing materials or providing strategic feedback in different areas based on your expertise and topical interests. So definitely take advantage of that interest form. All announcements around engagement activities will most likely come out through that newsletter or be posted on our website. So there'll be periodic opportunities for engagement as we move forward, apart from that core group that will continue to meet on a more scheduled basis to ensure that we're on track for implementation of the strategic plan.
Great. Thank you. That answers all my questions. Appreciate it. It's great work. It feels like, yeah, we should all be doing this all the time. So I appreciate it.
I also feel like this is important work. And if the grant is for 5 years, how do you see this being funded after that to continue this great work? And you might not have an answer for that. And that can also be frustrating to people who are using a system, not knowing how it's going to continue for future generations.
Yeah, I mean, I think, Renee, that's a concern for everybody, especially as we're seeing the maternal health landscape of supports and services shifting, and it feels like sometimes really quickly changing. So a piece of the grant is we're really hoping to address sustainability from the beginning, which I know is always kind of a goal, but really hoping to understand that as we're supporting projects and having that be a piece of the what we're looking at from the beginning. And some of the pieces we're doing around like the regional PQCs, for instance, like trying to understand, like, yes, there may not be funding for them to do individual projects after the 5 years, but hopefully we can at least figure out a way for the convenings to still happen and to make sure that that communication continues and that there's a structure for sharing information and elevating activities and things like that. And that's I think the extent of what we can do is to try to plan for that sustainability from the beginning. I don't know, Emily, if you have other pieces to add there.
Yeah, I think that is all kind of captured in the way we've structured this in the context of building relationships and sustainability. When relationships are built at the regional and at the state level, I think it becomes easy for us to sustain the momentum that we've garnered over the years of this grant. And like Katie said, we're hoping that we will be looking to support work through the sustainability framework. And part of that is elevating the expertise that sit on our task force to help disseminate opportunities for funding, in the private sector or that come across our desk, so that we can really support organizations in shoring up their funding sources, diversifying funding sources, and helping the system as a whole look towards different opportunities of sustainability, rather than just relying on, one big federal grant to move the work forward.
I have a question. I'm wondering if you could speak a little more to the process, the engagement process that led you to these three goals, and if there were any surprises or any sort of major takeaways from that process that got you here.
The goals themselves are prescriptive of the grant. So those 3 overarching goals are things that the grant told us we need to focus on. How we go about focusing on those, that's where the data piece comes in. Our engagement process, I think, has been something that our team is really proud of. We have been able to bring together folks in a variety of different formats across the entire state. And Katie, I'd love for you to jump in and kind of talk about that like clinical community bridge that we've been really focusing on.
Yeah, I mean, a piece of what we've designed, all of the interventions that we are trying to support is looking at it from that lens of how are we connecting spaces, and that's kind of that's a large theme of this work is as we're seeing access to clinical care changing in Vermont, which is a really, really, really unfortunate. And we don't have control over that because that is something that is a financial decision of a hospital. You know, we can't impact that, but how can we support these other spaces to hold families as that landscape changes? So that is a piece of that we focused on quite a bit. And so when we looked at the goals, we had these 3 overarching goals, but then you know, how are we using this idea of integration across spaces in every single way we can? And the other thing is a lot of the strategies and recommendations that you saw came directly from that process of outreach that we did across the state. So we had those virtual kickoff sessions, we had the survey, we had the summit, and then we have been doing a process of coming in person to regions, sitting down with people face to face from clinical teams of the hospital and community teams. We're continuing that right now. We're kind of in the middle of it right now. And just doing as thorough as we can process of hearing from people who are involved in the work in all these different spaces and understanding, like, again, how to refine the strategies based on feedback, because everything we presented is things that have come up from our partners across the state, and now we need to understand like what is missing and also how do we refine those strategies and recommendations to be a little bit more actionable. Some of them may be less able to be actionable than others, so how do we, you know, balance that? So, and how do we look at our policy friends and then also our, you know, providers and things like that, and like have recommendations that kind of span all those spaces too. I don't know if that answered your question, Kate, or not.
Yeah, thank you. Definitely.
Okay.
To one part of your question, Kate, I think one of the things that we are most surprised about and incredibly pleased is just the turnout of our clinical folks. It's extremely difficult to get folks who are in practice to step away and engage in such a robust way. And they have really shown up in this space to advocate and to collaborate. So that's been lovely. And I think there's just been this overwhelming acknowledgement that a lot of folks are identifying the same issues across these spaces. And so mobilizing as a state around these across our sectors is going to be so powerful. And we all have the same vision in mind, right? That safe, supported, empowered, all people should feel that way in their birthing experience. So people are passionate and they're willing to engage, and it just seems like the right time to be doing this work. And we're really, really excited to be able to build on that momentum.
I think that's a really important part that Emily highlighted again, is that piece that you can tell that this is really important to people, and that there's a missing piece that people haven't been feeling, is this cohesion across, like, what is our vision for our state, what is our vision for maternal health in our state. Like, that has been we haven't had, you know, this approach like a strategic plan that kind of pulls it all together. And so the fact that so many people are engaging really tells us that it's needed.
Thank you. That's so wonderful to hear. And certainly with Vermont's early childhood strategic plan that we've been stewarding at BBF, there's a lot of overlap and alignment too in the goals. So that's we're with you. That's exciting.
Yeah.
And that's something that we're really excited to do with this work, is bridge the gap, because we know that maternal health, family health, child health, they don't happen in silos, right? So how can we build connections between strategic plans that exist in these other spaces and the maternal health work that we're doing under this grant umbrella, to drive change across that historical and generational approach to care that I think Vermont is really grounded in.
Anyone else have questions or reflections and feedback?
I think some people have heard this already. I recognize some faces. We're doing a lot of overlapping presentations just to make sure we are able to access everybody that is interested. So yeah.
Yeah, we will, if it's all right with you folks, we'll post it on our BBF YouTube page and then share the link out with all of the regional managers and the regional councils and have that available too. And I'll make sure to include the links so folks can get to the interest form and such too.
Hey, I'm just going to point out there's a question in the chat. So what are the next steps? When would we hear from you again?
I think it depends on how you want to engage, right? So if you've indicated you want to be more deeply involved, it will be a little sooner probably, versus somebody who says, I just want to get updated by an email once in a while. So it kind of just depends on, but the big next steps are pulling together the task force in the new year, pulling together the regional PQCs in the new year. So those are both sort of January, early February kind of goals. Those are the two big pieces next. Emily, anything to add about timeline?
Nope, I think we are just looking to have feedback on the actual strategic plan through January, early January, but the sooner the better as we look to improve that. And like Katie said, just filling out that interest form, I think is great to get on our listserv for newsletters and updates. Kim, do you have anything on hearing about PQC activities?
Yeah, I think it's
sorry, I put you on the spot.
Well, I was just going to say with the regional PQCs, the statewide PQC and the family and child health coordinators will be reaching out around that in the new year. So you'll hear more about that, depending on where you live or where you support people. Okay.
Great.
Thank you all.
Thanks so much for being here. And we'll be in touch both at BBF and then individually. I'll share out the links so folks can be in touch with you directly with their involvement. Great.
Thank you so much for your time.
Have a great afternoon, everyone. Take care.